Asalamualykum, everyone. Thank you so much for joining us. My name is Aisha Shazad, and I'm a recent graduate, studied psychology and bio. So we're here today to talk about a really important and relevant topic, and that is mental health 101, and in particular in pertaining to Muslim families. So joining me today, I have Maliha Malik and Imaani Ali. So Maliha Malik is a marriage and family therapist at Counseling and Psychotherapy of America. She graduated with her bachelor's in psychology from U Connecticut and has a master's in marital and family therapy. Maliha has worked in the mental health field for over 10 years in various areas such as substance abuse, intimate partner violence, trauma-informed care, and more things. Sister Maliha currently lives in Connecticut with her family. Can you guys see her? Can we see her? She's somewhere here. Okay. Okay. And Sister Imaani, she obtained a Master of Science in Marriage and Family Therapy from Northwestern. She has been working as a therapist for the past 4 years, and she specializes in family issues and couple relationships. She has also spent several years working as a counselor and program director for Muslim Youth Camp in Chicago, where she works with Muslim teens in their spiritual and identity development. Sister Imaani currently works at Counseling and Assessment Clinic of Worcester, where she treats adults, adolescents, and couples for a variety of mental health issues. Say salam, guys.
Assalamualaikum.
Assalamualaikum, everyone. Thank you for watching.
Absolutely. So thank you so much for joining us today, both Sister Imaani, Sister Maliha, and the audience. Without further ado, we're going to get to our topic, which is Mental Health 101 for Muslim families. But before we get to that, let's try to address the question. So what is mental health, and in what way does it pertain to Muslim families in the first place?
Imaani, you want to take that?
Okay. So when I talk about mental health, I usually compare it to physical health. So when you're going through your life and you have an ache or pain in your body, or something is just not feeling right, you know that something's wrong, and you start thinking about, okay, what are all the reasons I might be feeling this tightness in my stomach or this pain in my leg, and you think about, you know, what did I eat, you know, what's going on, and then eventually maybe you go to a doctor to figure it out. Mental health is a similar process. It's just pertaining to your emotions and your brain, your mind. So this is, you know, how is my emotional health? How am I feeling? What's going on in my thoughts? All of that is related to mental health, and it affects us just as much as our physical health. You know, the way we talk to people, the way we go about our day is tied not only to physically how able we are, but also how we're feeling that day, and the thoughts that are going through our mind. And so, you know, just like we think about our physical health, we need to be thinking about and talking about our mental health, and really understanding what it is that we're feeling and how that's affecting our behavior.
Absolutely. Sister Maliha, do you have anything to add to that?
No, it's perfect. Yeah.
Okay. Yeah, so moving on, we talked about kind of what mental health is, how it's similar to physical health, because you have to constantly look after it. And what way does it pertain to Muslim families, and why is this a conversation we should be having?
Well, I think that, you know, Muslim families are just like any other families, right? We're all affected by the same stuff. We all experience similar situations, and we have to, you know, be more aware, alert, and understand that this is a process that everybody goes through. And that it's a normal process to go through. You know, experiencing mental health is nothing out of the abnormal. You're going to experience things in your life that are going to cause you to feel a certain way, or you to react in a certain way. And, you know, that can happen to Muslims as well, just like anyone else, you know, in the world. So I think it's more important, though, for Muslims to kind of understand what mental health is, because for a very long time, we've really ignored the concept of mental health.
Right.
We don't allow ourselves to believe in it or to focus on it. We rather were able to give it like a different name, or say that it's coming from a different, you know, I guess like a different part or a different reason, you know. I've heard stories where I've been told like, oh, the reason you feel sad is because you're not praying, or the reason that you feel, anxiety, or, feel, hyperactivity is because, you're not focusing on your deen and like your religion, or you're not practicing as much. I'm not invalidating that in any way, but I'm also saying that there are other reasons why these, situations are caused, or experiences are caused. So it's important to really pay attention to what is going on with the person and really being alert. And we're seeing more and more in our youth that they're experiencing depression, they're experiencing like ADHD, or they're experiencing anxiety and depression. We hear a lot more about young kids who are committing suicide, or who are really holding in all of these feelings and not really talking to their parents or their friends about it, because they feel that they might be judged, or that their level of religiosity might be affected or judged if they do that. So as Muslims, I think we need to be a little bit more alert and, pay more attention to the fact that our kids and the youth in our community are experiencing all of these things, and we just might not be aware of it because we're not, thinking about it, or we're not making ourselves, aware or educated about the fact that these, conditions exist, and that they really do have a huge impact on an individual.
Yeah, absolutely. And just to kind of echo that, I think what you've basically said is that mental health is important for everybody, obviously, but for Muslim families in particular, because we've had kind of a stigmatization, right? Mm-hmm. So it's important to think about deeply like where those sources of certain emotions come from. And that leads us to the concept of emotional awareness. Sister Imaani, do you want to talk about that?
Mm-hmm. Yeah, so echoing off of what Sister Maliha said about being aware of how we're feeling and knowing, how that might be affecting our families and our lives, there's a particular emotion that I wanted to focus on, and that's anger. Anger is something that we all experience. There's no one who's exempt from experiencing anger. And by anger, I'm talking about frustration, I'm talking about irritability. I'm using anger as the umbrella term for all of that. And something I've noticed in living in the Muslim community and working with certain people is that for a lot of mental health issues, but particularly anger, the person who's witnessing, the family member who's feeling angry will sort of oversimplify what's actually going on for that person, that they're feeling anger, or they're feeling depressed, or they're feeling any of these things because it's this one thing that's affecting them, or it's this one religious practice that they're not doing, like Sister Maliha said. And very often the emotions we're feeling have a much more complex story behind it, and anger is one of those. To kind of demonstrate that point, I wanted to show you all a picture that I have. All right. So I got this image from the Gottman Institute. This is, they're a pretty big name in the couples therapy world. They do a lot of research and provide information on how relationships work. And they created this metaphor called the anger iceberg. So I'm going to read the words at the top. Icebergs are large pieces of ice found floating in the open ocean. What you can see from the surface can be misleading. Most of the iceberg is hidden below the water. This is how anger works. Often when we're angry, there are other emotions hidden under the surface. So if you're a person who's experiencing anger, you're thinking about this really unpleasant feeling that you're having, and you're wondering what's causing it, and you might be moved to act upon it. And, different ways that we act upon anger, for example, could be sending a passive-aggressive text to someone, or shutting out your family members, or yelling, a lot of different things that can harm our relationships or can harm ourselves. And if we understand the other emotions that are behind our anger, that can lead to much more healing and productive conversations. So for example, if someone's feeling angry, what they might actually be feeling underneath that anger is rejection. Let's say that you're you have a friend whose child is getting married and you weren't invited to the walima and you're feeling really angry about it. If you're just acting upon the anger, you might, start saying something negative about your friend, or you might not invite your friend to your child's wedding, doing a lot of different things that ultimately harm the relationship. If you understand that what you're feeling is actually rejection, you have this deep relationship with your friend, and not being invited to this walima makes you feel like maybe she doesn't care about me in that way. Maybe, this relationship is not as deep as I thought it was. That is a point where you can either approach your friend or even approach another loved one and say, I'm feeling rejected. I'm feeling hurt. I'm feeling like there's some disconnect here, and I want to do something about it. That can lead to much more productive conversations rather than just responding with the anger. Another example is embarrassed. A lot of times we feel angry because really we're feeling embarrassed or we're feeling humiliated. You're at a party and your wife says some joke about you and you get really angry because you didn't approve of that kind of joke. You might, stop talking to her. You might yell at her. You might just sort of shut down. And that's all acting on anger. If you're understanding that really what you're feeling is feeling embarrassed and feeling humiliated, and approaching your wife with that, saying, when you said that thing at the party, it embarrassed me in front of my friends, and that wasn't okay. That's going to lead to a much more productive conversation, because that's going to, pull at the other person's heartstrings and make them question what they did to embarrass you, rather than just being angry and leading to another argument. So I think this affects a lot of different aspects of life if you really look at the anger that you feel and the emotion that's underneath. And doing something about it. This is emotional awareness. This is when we know what we're feeling, we can have more productive conversations and do things that are more productive rather than just reacting.
Absolutely. And kind of the model of couples therapy is focusing on the importance of conversation and the importance of communication as really like an important tool to because having issues in a relationship, in any relationship, whether it be a marriage or a friendship, is going to happen. And it's about how you can communicate those issues and how you can work them out. That's really the most important thing. And so getting in touch with those deeper emotions is definitely a really important aspect of that. So to dig deeper into what kind of things can affect this kind of iceberg, like you see anger on the surface and there's other things underneath. When we talk about mental illness, what kind of things can affect these portrayals in a way?
Yeah, so I want to focus on a couple of mental health issues that we often see in therapy. The three that we kind of focused on that we wanted to talk about is depression, anxiety, and trauma. These are pretty common presentations that people who come to therapy have. And so by bringing awareness to this, what this looks like for the average person, it can help you, someone who might be feeling this, really understand how you're feeling and come up with some ideas of what to do. So I'll start with depression and anxiety, and then we'll move to Sister Maliha for trauma. So depression. The way that it's defined, it's referred to as major depressive disorder in our DSM, the diagnostic manual. I brought mine here. This is what we use to diagnose people. The definition there is feeling a depressed mood most of the day, nearly every day, and or experiencing a loss of interest or pleasure in most activities. So what is a depressed mood? Feeling depressed could be feeling sad. Feeling depressed could be feeling no emotions. Feeling depressed could be feeling irritable. Depressed could be, I'm pretty neutral. I'm not really feeling anything, but sometimes I dip down into anger and sadness. Sometimes I go back here, but I'm never really going up here to happiness and pleasure. All of these things are different ways we can define a depressed mood. And when it goes into what would be called depression is if we're feeling that almost all the time. Loss of interest or pleasure in most activities, that looks like, I'm at home, I'm seeing all these things around me that I could be doing, and I just don't really feel interested in doing any of it. Or I had these hobbies that I used to really love, but when I do them, I'm not really getting any pleasure. I play basketball with my friends, but I'm not really enjoying it like how I used to. Or I'm surrounded by family, but I'm not really feeling that happiness or that love. There's a disconnect there. And so both of these things, feeling a depressed mood and having a loss of interest or pleasure, we all experience that to an extent in a way that's completely normal. If you're having a difficult time, you might feel a little bit more down than usual. You might not really want to do anything. When this pandemic started, I'm sure a lot of us were feeling a little bit depressed because we couldn't go out, we couldn't go to parties, we couldn't see our loved ones, we couldn't go to restaurants. A lot of the things that we used to really enjoy, we can't do anymore. And a lot of us very appropriately felt a little bit depressed because of that. Where it becomes something that you want to really look at and think about what to do, if it's starting to consume your life, if it's something that's happening all day, if it's happening every day, and that's lasting for multiple weeks, that is going a little bit beyond the realm of, you know, what we all kind of experience on an everyday basis. And that's where you might want to think about what to do to change how you're feeling. And we'll get into different ways of you know, what you can do if you notice yourself having some kind of mental health difficulty. Before I move on to anxiety, is there anything else that either of you wanted to add on depression?
I think you hit the nail on the head. Like, that's pretty thorough.
Okay, so moving on to anxiety, again, referring to the DSM, our diagnostic manual, the way that that has been defined is excessive worry about a variety of topics or activities that is difficult to control. And the key here is it being difficult to control. So this could be worry, this could be nervousness, this could be dread, a feeling like something's bad is going to happen and you can't really identify why, avoiding certain situations because of some kind of underlying tension or fear. With anxiety, there's a lot of physical ways in which this can show. Could be feeling muscle tension. This could be not having an appetite. This could be feeling like the butterflies in your stomach or a pit in your stomach. All of these different things. Anxiety is one that can very frequently show up in physical ways. And the key there is that it's difficult to control and it isn't going away. So similar to the depression, if a level of anxiety is appropriate and normal in certain situations, if you're taking your final exam tomorrow and you're right in between the two letter grades and you know that this exam is going to have a big impact on your grades, you might be feeling worry about it, and that's totally normal. And in some ways that can actually be adaptive because it keeps you alert and it keeps you focused. Where it gets to be something that you might want to consider addressing is if it's preventing you from being able to do what you need to do. So if you're feeling so anxious and so worried that you can't even sit and study, or you can't even sleep, or you're feeling so worried about what's going to happen that you're not even leaving your house, that's where it starts to be something that you want to look at, and you want to think about how you can do things to help with this emotion and to relieve it. There are a few qualities that you might notice that could be a symptom of either depression or anxiety. Often they look very similar. This could be fatigue. This could be having difficulty concentrating, noticing appetites, feeling irritable, or having some kind of disturbance in your sleep. It's like having a hard time falling asleep or having a hard time staying asleep. All of these things, it can be due to depression, it can be due to anxiety, it could also be due to something biological. You know, it's important to look at all of the different aspects of your life. But something to keep in mind is that depression and anxiety can both be experienced at the same time. They're not mutually exclusive. And so if you're noticing yourself feeling either of these things, again, most of the day, nearly every day for a long period of time, you might want to think about what I can do to relieve this feeling. And what might be triggering it, because sometimes it might be fully appropriate, sometimes it might be coming kind of out of nowhere, and you might want to look at, you know, why is this happening?
Absolutely. And you did mention this, but I just want to hit it hard really home that a level of anxiety and stress is normal and actually adaptive in most circumstances. So a level of stress is necessary in order to accomplish certain tasks, right? If we don't get stressed about things, then nothing will happen, right? And if we don't have a level of urgency that this has to take place, then sometimes it won't take place at all. And the thing with anxiety, like you said, is when it's to the point where it controls your life in a way. I know from the research I've done that one of the ways this manifests in the Muslim community is OCD for wudu, for example, is something that is pretty common in Muslim communities. You'll have people who obsess over their wudu. It's like making wudu is great. It's something that you should be doing before every prayer or whenever you want to. But the whole thing was, oh my God, did I wash my feet right? I have to go back and make wudu again before I pray. That is just an example of like how we see it in our communities. And I just think that that's something we should be paying attention to, that these issues are, they affect Muslims as much as they affect everyone else. And they affect Muslims in certain specific ways as well.
Mm-hmm.
So I wanted to talk a little bit about trauma. You know, as Imaani mentioned, that like these are some of like the core things that you'll see, or the main things that we often see as we see our patients in our offices, or you'll even see when you're working within the Muslim community. So trauma can be defined in like different ways. But the trauma that we're going to be talking about or focusing on mostly is psychological trauma. So psychological trauma is damage to the mind that occurs as a result of a distressing event. Trauma is often the result of overwhelming amount of stress that exceeds one's ability to cope or integrate the emotions involved with that experience. So again, like think about what we just heard a little bit about depression and anxiety. When it's more than what it needs to be, or more than what you should be experiencing. We all experience trauma in different way. So I'll talk a little bit about that as well. But we have to kind of keep that in mind when it's too much for you to cope with or to manage, and it's over exceeding your ability to move forward in your life or in your day. That's when you know that, okay, something like a little bell should go off saying like, okay, I need to really look into this and see what it is. One of the things that we'll be focusing on is the post-traumatic stress disorder, which is very common. It's known as PTSD, and that is a mental health condition that's triggered by a terrifying event. And either experiencing or witnessing it. Symptoms may include like flashbacks, nightmares, and severe anxiety, as well as an uncontrollable thoughts about the event. So, we hear a lot about PTSD when if you're, either if you know veterans or if you work with veterans, you hear that when they're coming back, from their time spent overseas or in a war-torn country, you'll see that they experience it a lot. The inability to continue living as a civilian or continue to live within your normal condition. You would also see, trauma or PTSD being diagnosed with refugees when they move over to a new country. Being torn away from your home or your normalcy, and having to restart something or having to relive some of the experiences that you had in order to get to where you are today. So what are some events or situations that may cause trauma or PTSD? So one of the main ones is being a victim or a witness to an incident that made you feel scared or was scary. Being in a car accident, being a victim or a witness to a shooting, being a part of a war-torn country, being a victim or a witness to an abuse or neglect, within your family, having something taken away from you, like your child, or being in a very messy, divorce or relationship where you're either physically abused or emotionally abused. And also trauma can be caused by a lot of different events or incidents. So it's not just the specific ones that I mentioned, but those are the common ones that you'll hear more about, either if someone's talking to you or if, a family member is coming to you and disclosing how they're experiencing, then, you could be like, oh, okay, maybe this person might be experiencing something that's traumatic and I may have to refer them, or I should check in with them to see how they're feeling and where they're at. So there's different types of trauma. So the three main types of trauma are acute, chronic, or complex. Acute trauma results from a single incident. Chronic trauma is repeated and prolonged, such as domestic violence or abuse. And complex trauma is exposure to varied and multiple traumatic events, often of an invasive or interpersonal nature. What to look for if you think someone is experiencing trauma. So these are the common traits or common criteria that you'll see if you think someone is experiencing trauma. You should look for shock, denial, disbelief, confusion, difficulty concentrating, anger, irritability, mood swings, anxiety and fear, guilt, shame, self-blame, withdrawing from others, feeling sad or hopeless, feeling disconnected or numb. So now think back to what Sister Imaani was talking about. She had also mentioned that these are some of the criteria for anxiety and for depression. So these symptoms go hand in hand, they're connected. And they can lead to different, diagnoses based on how often you've been feeling this way or how long this has been going on for you and what is it related to. So, what is PTSD? PTSD is post-traumatic stress disorder. What happens, when you have PTSD? Well, some of the main things that, go on that you experience when you have PTSD is that you have intrusive memories. Some of the symptoms of intrusive memories may include like reoccurrent, unwanted, or distressing memories of a traumatic event. Nightmares. So, those are the big ones. If you keep having similar nightmares over and over again, then the cause of the nightmare is because of something that happened to you, something that you experienced. Reliving the traumatic event as if, if it were happening again. So flashback. So that could reoccur from like a sound, let's say a banging of a door or fireworks or, anything that's loud. Could be, kind of like a flashback to something that makes you nervous or makes you scared. Upsetting dreams or nightmares, several emotional distress or physical reactions to something that reminds you of the traumatic event. Avoidance. Symptoms of avoidance may include trying to avoid thinking or talking about the traumatic event, avoiding places, activities, or people that remind you of that traumatic event. Negative changes in your thinking and mood. So symptoms of negative changes in thinking and mood may include negative thoughts about yourself, other people, or the world, hopelessness about the future, memory problems, including not remembering important aspects of the traumatic event, difficulty maintaining close relationships, feeling detached from family and friends. Other aspects are changes in physical and emotional reactions. So being easily, startled or frightened, always being on guard, watching over your back, looking back to see if someone's following you, or, if someone taps you on the shoulder or, grabs you from the back, like playfully, but really you feel it as if it's something really strong or in a negative way. So you feel like your body's in danger or yourself is in danger. Self-destructive behavior such as drinking too much or driving too fast, trouble sleeping, trouble concentrating. And something really good to think about or important to think about is that for children 6 and older or younger, signs and symptoms may also include reenacting the traumatic event or aspects of the traumatic event through play. So if you see, if you watch your kids play with their toys and, let's say if they were in a car accident, right, with you and the family, and they haven't quite talked about it or processed it yet with you, they might, play with their cars and they might do some like a really violent, car crashes, or they might like, put ketchup on their toys, like there's blood everywhere. It's just like they're thinking about it and they're processing it in a completely different way. So it's important to check in with your child and say, hey, why did you do that? Or where did that come from? Did you see it in TV or are you thinking about this? And then if you see it happen often and all the time, then again, think about, okay, what should I do next? Who should I talk to about this? Also, frightening dreams that may or may not include aspects of the traumatic event may also occur in children. So the intensity of symptoms. So the intensity of symptoms of PTSD can vary over time. You may have more PTSD symptoms when you're stressed in general or when you come across reminders of what you went through. So for example, you may hear a car backfire and relive combat experiences. Or you may see a report on the news about sexual assault and feel overcome by memories of your own assault. One of the things that I found very interesting and, have found very interesting, like, working with clients with PTSD is like talking about what happens to them physically when they're experiencing, PTSD or when they are reliving that moment. And, there's a lot of different things that happen to your body, like your heart rate increases because there's increased blood flow throughout your body. Your stomach, your digestion slows down or it stops. Your hands or extremities like start trembling and shaking. Your skin becomes like, there's more sweat production. So you find yourself sweating more. Your lungs, you tend to breathe more and harder because there's increased blood flow throughout your body. You get like a dry mouth or decreased saliva because of everything else that's like going on through your body. So it's important to know and kind of be able to see the signs of what you're experiencing. You can see it physically as well. Like your eyes, you'll see that the pupils dilate. They became bigger, or, you feel like you can't sit in one place. You find yourself moving or pacing back and forth. These are all things that happen physically that tell you, okay, there's something going on and I got to figure out what that is. So those are really, basically the signs of trauma in general, or, experiencing PTSD. But like I mentioned before, trauma could be experienced in different ways. There's also physical trauma that a person might experience. So you have to be aware of, any marks on a person. And if you're a mandated reporter, like, therapists or counselors are, doctors are, or teachers are, you'll see that, we look out for these things when we work with underage kids or minors. And we even look for it in adults, to see if they're self-harming in any way. Because these are all signs that there's something going on. So there's physical and emotional signs of trauma.
Something that I want to add about trauma and why it's important for us to be aware of if we have trauma or if our kids have trauma is that especially if you experience trauma at a young age, like pre-puberty, it creates changes in your brain. Like the neural connections that you make in your brain are affected by this. And so if you have a child who's experienced significant trauma, violence or abuse or something very, very, very scary, ignoring that ignores these real changes that have happened to this child's brain that will affect them as they get older and as they enter relationships and as they have kids of their own. This doesn't mean that it's hopeless. This doesn't mean that positive change can never happen. It just means that there are ways in which they are going to interact with the world that is affected by the trauma they experienced, and that those are things that that they need to be aware of and that you as a parent should be aware of. Going to therapy or talking to someone really processing this trauma are ways in which you can change those brain connections so that it's not constantly feeling like it's under attack. That's kind of something common that can happen for someone who has trauma, is feeling like the trauma is continuing to happen to them. By really processing and teasing out, what they're experiencing today versus what they experienced back when the trauma was happening, is how you can change the brain back into one that doesn't have to feel constantly in danger. And for any kind of negative experience we have, even if it's not something that you would consider traumatic, but even if it's just something negative, it's going to create some kind of emotional trigger for us. If you grew up in a household where there was a lot of yelling going on, and yelling was often followed by some kind of punishment or negative consequence, when you get older, every time you hear yelling, your mind is going to feel all those same feelings it felt back when it was a kid. And it's going to trigger those emotions. When we talked about anger before and how anger can often be a covering up for another kind of emotion underneath, if you went through some kind of experience that made you feel really hurt or made you feel really scared or really rejected, the next time something similar like that happens, that emotion could come up, or anger could come up, because anger is taking your emotion that you're feeling is taking the form of anger. And so understanding these triggers can help you live a much more life under your control. If you're not aware of your triggers, life is going to feel very chaotic, very unpredictable and out of control, because these things are going to come up that are going to make you feel under attack. Understanding these triggers and working on ways to to calm yourself down when you have those triggers can make life a little bit more manageable. And I mean, in couples therapy, there's so many examples of how that we as therapists learn of how your experiences as a child can affect how you are as an adult, your experiences with your parents or whoever raised you, what the model that you saw of how a marriage relationship is supposed to be will affect how you are in your future marriage. If someone who's been married before and is now moving on to another relationship, your experiences in that first marriage are going to affect what you expect or how you behave in the next relationship. And so it's always important to be aware of the things that we've gone through when we were younger and how that can affect how we're behaving now as adults or as older teenagers or whatever age that you are.
So what to do next, right? We've talked a little bit about what some of the disorders are, what is going on with your emotional health. How can you, identify some of the symptoms that are causing this distress in your life? Now, what should you do next? We always say seek professional help. It's like I'll use the metaphor of when you're on a plane and you use, as soon as you get on, they give you a very detailed information about what you should do in case of a plane crash, right? The first thing they say is that when the oxygen, masks come down, first put on your mask, then help somebody else, right? So that's exactly it. You got to help yourself. If you're not helping yourself, if you're not taking care of yourself, you're not going to be able to help anyone else around you. And one of the best ways to help yourself when you're dealing with something with your emotional health is by, seeking professional help. So what's professional help? It does, seeking professional help mean going to an imam or going to a psychiatrist or a psychologist or counselor? Well, going to an imam is great. And I've mentioned this before. It's great for your spiritual guidance. Your imam can sit down and talk to you about anything related to your spirituality or your, any questions you may have when it comes to your religion. However, most imams are not trained to be counselors. They may not understand when to refer you or who to refer you to for, taking care of your emotional and mental health. So it's important to look up and see who is your local psychologist or psychiatrist or counselor. Each person varies in their field, right? A psychiatrist is someone you would go to if you're looking to be medicated. A psychologist is someone you go to if you're looking for assessments to see, where your where your intelligence levels are at, or if there are any developmental delays or anything like that. However, a counselor or therapist is someone that you would go to for talk therapy, which is like one-on-one. This is a person who you can sit down with and share everything that you're experiencing and talk about, your symptoms, how, you've been feeling, what's been going on for you, what has changed for you. And once you do that and the, counselor or therapist is able to identify what may be the cause of this, he or she may be able to refer you out if medication is needed to a psychiatrist or a psychologist who has a medical degree, who would be able to provide you with the necessary medications. Do you always need medications when you're experiencing any of these? No. There are many times when you can easily work through therapy, work through individual one-on-one therapy without actually having to be medicated. But it really just depends on, what's the severity of your situation and condition, and what you're doing to not only seek help, but also to help yourself. Because that's a big part of therapy. You have to be committed and you have to be willing to say that I'm going to do my part in doing what's necessary to feel better and to improve my health.
Something that I've noticed with the clients that I work with is if they've been in therapy before and I asked, how did that go for you? Something that comes up is, well, I had a therapist before, but it didn't really help me. I didn't really feel like I was getting anything out of it, or we ended up talking about the same thing over and over again and it wasn't really helpful. So I just stopped going. And something that I always tell those clients is that if they're experiencing that with me, I would much rather them hurt my feelings and tell me what I'm doing wrong than to have them just stop coming at all. If you are in therapy and it feels like I'm not really getting the help that I need, your therapist is trained to receive that feedback and work with you on that. You know, like most of us are not sitting here just because we like hearing the sound of our voice. You know, we're here because we want to be able to help you, and we want to be able to work with the problems that you're having and really help find the solution that's best for you. And so if there is something that's happening in the therapy room that feels uncomfortable or feels like it's not really being useful, to bring that up, because it gives, every client is different, and it gives the therapist feedback on what works best for you. If there's something, a metaphor for this is like if you're going to your regular doctor and you're going through your checkup, the doctor's going to ask their routine questions, but there may be something that you've noticed about your body over the last week. Maybe you have a pain in a specific part of the body that the doctor's not automatically going to ask you about, but is important for you to bring up because you know that this doesn't feel right and that this is something that we have to be working on. Similar if you're in therapy, if you're talking about your routine stuff, you know, your therapist is asking their routine questions, but you feel like there's something at the back of your mind that's not feeling right that you know is affecting you, to bring that up, because the therapist may just not know that that's something that you're going through, and all it takes is for you to bring it up. A couple of misconceptions related to therapy that I just wanted to quickly address is specifically about the idea of having like a Muslim therapist versus a non-Muslim therapist, because I know this is something that's very important for a lot of people. The fact of the matter is that sharing an identity with your therapist can make certain conversations easier. You know, you're not going to have to explain what Ramadan is. You're not going to have to necessarily explain what this scarf on your head is. There's certain words and phrases and concepts that you sort of just say, and the therapist will understand what you mean. That doesn't mean that your Muslim therapist is going to understand you completely. You know, every person's life is different. The way that every family practices Islam is different. You know, we all have the ways that we might interpret an imam's advice slightly differently. And so if you're talking about your relationship with God, I as a Muslim therapist am not going to understand automatically what you mean unless you explain it to me, just like you might have to explain to a non-Muslim therapist. And so keep that in mind, that if you are seeking therapy and you're specifically looking for a Muslim therapist, that certain conversations may be easier, but that doesn't mean all the conversations are going to be easy and the therapist is going to understand you completely. Another misconception about therapy is that the therapist will be, that therapy is giving advice and therapy is telling you what to do. In some circumstances, like if we as the therapist notice that something used to really work for you and it's not working, and that you're not really doing, like a certain coping skill, it used to really work for you and you're starting to struggle and you're not doing that coping skill anymore, we might bring up, you know, hey, you used to do this and it really worked, why don't you try doing it again? So little things here and there is when we'll tell you to do something or give advice, but a big part of therapy is you doing the talking, you explaining sort of what you're going through and teasing out your thoughts. And I know a fear for a lot of Muslims and Muslim parents is that if I have a non-Muslim therapist, they're going to try to change my values, or they're going to try to tell me to do something that doesn't really go well with Islam. And that we as therapists, I mean, me as a therapist, I'll speak for myself, my mission is to help you find the based on your values. Even if you're a Muslim and your values are different from mine, I'm not going to help you based on my values. I'm going to help you based on your values. And a good therapist that is really focusing on the client is going to do that as well, whether they're Muslim or not. It's just something to keep in mind, because I know that that's something that comes up a lot when people are seeking therapy, is not wanting to see a non-Muslim therapist or not wanting their child to see a non-Muslim therapist because they think the therapist is going to brainwash them or give them haram advice. It's much more focused on helping you with your mental health issue.
Exactly. I think an important takeaway from that point is the fact that therapy is like a scientific practice, that like we were talking about, there are certain like mental health issues are just issues with your mental health. So in the same way, there are treatments and there are things that we have like in place to treat them and to address them. And so that kind of behavioral therapy, that kind of conversation because it is like sort of scientific, it won't vary severely between a Muslim and a non-Muslim practitioner, unless you really want that kind of cultural connection, in which case you can seek it out. But I would encourage people to not shy away from any type of counselor. Like just having those conversations and being able to decloud everything that's going on in your head can help you make really important decisions.
I saw that we had about where to find a therapist, because we're talking about therapy. So there's a couple of resources I just wanted to share. As kind of like a first resource I give to people is going to psychologytoday.com. It's a pretty comprehensive list of a lot of different mental health providers. As Sister Maliha said, there's a lot of different kinds of mental health services that you can get, and a lot of the people who are working in that field create their Psychology Today. If you go to the website, it's pretty easy to find a therapist, and you kind of put in the information that you're looking for, and you can find a lot of different people in your area. In terms of finding a Muslim therapist, there is a website that I have found called simamentalhealth.com/find-a-therapist. It's basically a map of that Muslim therapists have gone in their own profile to, and there's you can see kind of like where in the United States these therapists are, and you can zoom in and see if there's one in your area. This is not a comprehensive list. It's just Muslim therapists around the community have added themselves to it. It's the only list that I've found that has kind of specifically for Muslims a list of therapists. I don't know if Sister Maliha, you found anything else, any other lists like that?
No, I was going to mention Psychology Today too, because I always recommend it to everybody who's looking for a therapist. I always say, just go on there. There's so many filters. You can put in exactly what it is that you're looking for, where, how many miles away from you, et cetera, and you'll get like literally pinpointed in the right direction.
Mm-hmm. I also know that's in Massachusetts. There a lot of specific towns will have therapy clinics. Like I know Shrewsbury has Shrewsbury Youth and Family Services. A lot of other towns in Massachusetts have this, and it's if you go to your town's website and find somewhere on the menu Youth and Family Services, a lot of times they'll have therapy options on there specifically for people who live in that town. So I know Shrewsbury for sure has one. I don't know specifically what else, but I know that a lot of other towns in the area have that as well. So that can be another resource if you're looking for something local that you don't have to travel very far to.
Yeah, I do know of another resource.
Call your insurance provider. Sorry, you can also call your insurance provider, and they should be able to tell you where mental health providers are located that actually accept your insurance and how many sessions per your insurance will cover. So these are like, again, like if you're looking to use insurance, this is the best way to go, because then your insurance provider will be able to tell you, oh, this provider is 10 miles away from your address, or 15 miles, or whatever the case may be. So it narrows it down even more. And then before going that this provider accepts your insurance, and you don't have to worry about, having that feeling like you get there, you like the therapist, and now you're like, oh my God, how am I going to pay for these services? Because the therapist might be out of network, or, anything of that sort.
Mm-hmm.
Absolutely. An additional resource that I recently came across is something called the Khalil Center, which is in Illinois. It might be in Chicago, but I'm not sure. But
it is in Chicago.
Okay, it is in Chicago. Yeah, they're a really cool. They're a really cool resource. They do a lot of things on like Muslim mental health interventions and stuff. And they have web therapy appointments. They have like counseling appointments. So if that's something you're interested in, then please check them out. They're pretty cool.
And right now, during this pandemic, most, if not all, therapy clinics are doing telehealth. So just like how we're giving this talk, they're doing therapy like this over the webcam. So you don't necessarily have to wait for the shelter in place to be over. You can get that resource right now. And I'm sure a lot of people could use it right now.
Absolutely. So I see we have a few questions in the chat room. Do we want to maybe tackle those?
Sure.
Okay. So this one was already kind of answered, but this is a question from Imam Asif. If someone is having mental health issues in our community, should they call an imam or a therapist?
Something that I was just going to add to, I think Sister Maliha gave a very good answer before. Something I was going to add to it is, you know, we all play different roles in our community, and an imam is definitely a great resource for, like she said, spiritual questions. I have found sometimes with Muslim clients that I have, if they start asking me a religious question of what should I do, you know, what's the halal thing to do in this situation, like I said before, as therapists, we're not giving our own values. I can't tell you Islamically what you should do. You know, I can only tell you what's the best for your own mental health. But if you do have that religious question of, you know, within the Sharia, what is something that's permissible for me to do? Or I know that this coping skill really works for me, but I want to make sure that I'm following Islam, all the Islamic values related to it. That's an appropriate question to ask your imam. You know, is this something that's permissible in Islam? But in terms of, you know, I'm having an argument with my wife and I don't know how to stop the arguments, that relates to like relational intelligence and relational health and mental health. That's something that a therapist may be able to help you with, because that's how a person interacts with another person in a relationship. And that is definitely, there are like prophetic guidelines. If that's all that you need, then that's all that you need. But if you're following all the prophetic guidelines and it's still not helping, then there might be something emotionally that's creating a block there that a therapist can help you with.
Awesome. Thank you so much. And then one other question we had, if Sister Maliha doesn't want to add anything, is do you have any practical ways and techniques for recognizing and dealing with anxiety? This is something we already kind of touched on, but just to reiterate.
Yeah, so there's a lot of different ways. I mean, anxiety is not the only thing, but I think even with depression or trauma or anything that you're experiencing that's causing distress in your life or in your normal routine, there's a lot of different ways that you can help yourself, you know, before trying to see if you need to see a therapist or a counselor. So some of the things that I usually recommend for my clients is, you know, start connecting with people, start talking about what you're experiencing. So talk to really good friends, not friends who are, you know, not your like 900 friends on Facebook or Instagram, friends who are, you know, always been there for you and you've been there for. So you have this like mutual relationship where you can depend on each other and talk to each other about things that you're experiencing or going through. Start seeking support from your family. Letting people in is really important, because by letting others in, you're allowing them to also start noticing the change that is occurring in you. So if you talk to your mom and dad and they didn't quite understand, then, you know, talk to your siblings. And if you don't have siblings and you're the only child, then start talking to your teachers or, you know, people that you can depend on that can, again, keep an eye on you and make sure, you know, kind of notice like how you're changing. So seeking support is really important. Taking care of your physical health. That's, you know, your physical health and your emotional health go hand in hand with each other, you know? So if you find yourself feeling really down and really helpless, and then you start, you know, eating cake, cookies, you know, drinking soda, you know, just binge eating on food that's really unhealthy for you, then it's only going to make you feel worse. It's not going to add to you feeling better. So you want to start like eating better. You want to start, you know, taking walks outside, you know, when the weather is really good. Maybe go for a run if you're a runner. Go work out, exercise. You know, all of these things get your blood flowing. It's a great distraction. It's a way to like, you know, change your mindset basically. Surround yourself with positive things. You know, if you find that the circle of your friends is just totally negative and are just, you know, kind of like down in the dark themselves, then maybe it's not a good time to check in with them and see where they're at. Rather, you know, find someone or find something that'll help you feel better. You know, watch a happy movie, something light, something lifting, something, you know, that'll make you laugh or smile or feel good inside. Read a book that is, you know, like a self-help book that's able to guide you through what you're experiencing or what you might be feeling. Journal is like the most amazing thing that you could do for yourself, is grab a notebook, start writing, you know. I have a lot of clients who I, you know, ask to journal and they like give me like the side eye and they're like, you know, either they're like these really like, old gentlemen who've been like, like in their 50s or 60s or 70s, or they're, really young kids who are like, can I just put it on my phone? And I'm like, it doesn't matter where you put your information, as long as you can go back to it. And as long as we can talk about it later, that makes a difference. So write about your day. And I always joke and I always say, get one of those like fluffy pens and say, dear diary, today is, and then start writing what's going on. It sounds silly, but trust me, when you put it down on paper, you take it out of your mind and you take it out of your body. So it's not there anymore and it's not affecting you in a negative way. So you can do that. Go to the beach or go to a nice like park for a nice hike. Surround yourself with nature. When we see different colors, there's a whole, area of psychology. It's called color psychology, that if you look at it and you study it, you'll find how colors affect your mood. So, if you are surrounded by colorful things like flowers and nature and grass and like, things like that, it kind of makes your mood a little bit better in the moment. Painting is really good because, again, it's a distraction. You're doing something with your hands. You can feel it. You can sense it. So it's like a sensory activity. Color. A lot of my clients, when they are really anxious, I tell them to color, and they, again, they look at me and they're just like, I'm not 5. I don't own a Crayola set. I'm like, trust me, go buy a Crayola set. Like, you'll love it. And, and then like, and what I do is I give them those, like, if they're adults, I give them the really hard adult, like, coloring pages that require you to like really focus and like pick color between the lines, which is annoying, but it reduces your anxiety because now you're so focused on this activity that you no longer are thinking about whatever's causing that, anxious feeling inside of you. Same thing with depression. Like, you're so focused that you're no longer thinking about, what's causing that feeling of sadness or hopelessness. So you're like diverts like your, attention, which is what we want to do in order to get you through to the next day or until you can seek professional help. And then, do the best that you can to get through your day by doing these activities. If you feel like I can't do any of these activities, then call someone. There are, every state has like a support line, or, you'll find in Connecticut where I'm located, we have 211 that you can call, and you can kind of tell them what you're experiencing, and based on what you're experiencing, they'll direct you to that department where there's a person working 24 hours, 7 days a week to kind of support you through what you're going through and refer you to other services. But it's really about taking your mind off your current situation and diverting your energy into something that you can just, focus on and forget about what it is that you're going through until you're able to call your therapist or seek help and really, work on what it is what the root causes of your situation.
Absolutely. And I think a part of that is where the spiritual aspect comes in as well. I know a lot of people who, as a coping mechanism, they'll start to read Quran, or they'll make tasbih, or they'll start like doing dhikr. And so all these things are just coping mechanisms you can use.
Mm-hmm.
Okay, so I do not see any more questions in the group chat, but I do have a question for you too, if that's okay. Okay,
Sure.
So we talked a little bit about this at the beginning, but how within the Muslim community, there's a lot of like stigmatization around the idea of mental health. How do we encourage Muslim youth and Muslim adults to seek professional help or seek help in any way they can while navigating that stigma?
Good question. I'm the sole believer of, just saying, just do it. Don't look at what anyone's going to say. Don't think about any judgment. You're not, you need to help yourself, and you need to find support for yourself. And everybody around you wants to be there for you, but they can't be there unless you're going to let them into like what you're experiencing. So, a lot of the times I've experienced working with Muslims who are like, oh, don't tell anyone that I came to your office or that I saw you, or, first of all, counseling services are confidential. They're never what you share in our offices does not get revealed to anybody outside of our offices, I've had clients within the community who are like, you know, how will you be able to connect with me in the community, you know, knowing everything that I'm going through? I was like, and I always say I'm one person in my office, which is a therapist, and I'm another outside of the office. So when I see you at an iftar, or I see you at the masjid, or I see you out at the mall, you know, we're just regular community members, like day to day. But when you're in my office, I'm your therapist, you're my client, and that's the relationship that I have with you. So I know that I'm able to step out of those two relationships depending on what I'm working on with my client or what's going on. So I always tell every person that comes my way, don't worry about it. Everything you share with me is confidential, and it's never going to be revealed to anyone. And and nobody has to know unless you want them to know. And when you want someone to know that you're experiencing this, it's your time to share that on your own. Iman, you want to add anything?
I agree with everything you said, especially the confidentiality piece. I think a lot of people worry that if I start talking about my problems to a therapist, is it going to get out? You know, is it going to get out into the community? Are they going to tell their family members? Like, we're not even allowed to tell the people we live with what we go through at work, because that confidentiality is so important. That's part of the reason why therapy is so effective, is because it's a place where you can fully talk about what's going through your life without worrying about the consequences of someone else knowing that. And we as therapists take that so seriously. We know that people are handing their lives over to us, and sharing, you know, their most vulnerable parts of themselves, and that's not something that we take lightly. You know, that's very, very important part of therapy, is maintaining that confidentiality. I think that if just another suggestion I would give is, if you know someone who you think could benefit from therapy, or you have one of your kids could benefit from therapy, making sure that you kind of destigmatize it for them. You know, reminding the person that this is not, it's not a sign of weakness to get help. You know, it's a sign of strength to understand that there is a problem that you're having and get help for it, and that it doesn't make you crazy. You know, we both work with so many people that we would never call crazy. They just are dealing with things that are difficult in life, and we're just helping them deal with it. And that you don't have to, you know, worry about your problem not being big enough for therapy. You know, you don't have to wait until you're in the middle of a crisis to seek help. In fact, it's better if you start seeking help earlier, so that more can be done, instead of waiting until, you know, you're at the worst case scenario. That it's something that the difficulties are things that we all experience, and the ones who are going to therapy are the ones who are actually doing something about it and seeking help for it, or the ones who engage in self-care. You know, there are a lot of different ways to address what you're feeling, and as long as you're doing something about it, you're on your way to conquering it.
Exactly. That reminds me of your metaphor for physical health as well. In the same way that you don't only see the doctor when you're sick, you also have regular checkups. You also do things like exercise and eat healthy to make sure you stay healthy. I think those kind of things apply for mental health as well. You don't have to be severely mentally incapacitated to seek out therapy.
Mm-hmm.
You could just want to improve your quality of life, and that's always something that a therapist can help with. Okay, so we are pretty much running out of time. So if we have any closing remarks, then please give them now.
I just wanted to give my appreciation to everyone who attended this talk, who's, you know, really paying attention to mental health, to the organizers at the Islamic Center who made this possible, who, you know, brought us mental health people together to talk to the community, because it's something that affects literally every single one of us, but so many of us are afraid to talk about, or feel uncomfortable talking about. And so I think it takes a lot of awareness of the community to bring this topic, you know, front and center. And so, you know, for anyone who listened to this and who really took the things that we had to say, thank you for caring about your mental health and that of those around you.
Yep, I second everything that Imaani said, and thank you everyone for coming. And being a part of this. It's great that we're, taking one step at a time to figure out, how we can manage mental health within the Muslim community.
Okay, so that's it. Thank you everyone so much for coming. I especially want to thank the Worcester Islamic Center for organizing this event and bringing us together. Thank you, Sister Maliha, Sister Imaani. It was so fun to meet you guys, and I really enjoyed this conversation. It really was an honor. So thank you all, and I hope you will leave this with some idea of like the benefits of mental health, like taking care of it and looking after yourself.
Asalamualykum.
Asalamualykum.